This segment sponsored by Viking Psychiatry. Okay, Sean, so how does this machine work?
Yeah, so I've got Kayla here. She's volunteered to be my guinea pig for the day. And so when clients come in, we put this cap on them, right? And I tell them it's always Instagram worthy, so they can post it for all their friends and family members to see. And what this cap does is it just provides us, if you see, we've got these lines on the front, and it helps provide targeting for where I'm looking to aim or treat what's called Kayla's motor threshold, which really just has to do with stimulating that motor cortex.
Okay.
And so we put this cap on her and we make sure that it's all lined up correctly here.
Okay.
And then as I come around here, we take this helmet and the helmet gets lined up differently based on the individual, right? So this is an individualized treatment.
Okay.
It's not a one-size-fits-all type of system, right? And so we take this cap and we're just going to end up placing it on her like this. And then we take this chin strap to hold it in place, and Miss Kayla's going to put 2 fingers under, because I'm going to press down firmly while I connect this. And some of the clients and staff joke that it's the Goddard pressure, because we want to make sure that that helmet is nice and snug.
Okay.
The better the connection to the skin, the better the connection we have inside. And so once we have this all lined up and we make sure that it's placed correctly, then Miss Kayla's ready to begin treatment. The interesting thing is with traditional treatment, it would take 45 minutes for a treatment. And with the newer traditional machines, it takes about 25 minutes. With this machine, I can complete a standard treatment in 9 to 11 minutes, depending on what I'm treating and their motor threshold.
Yes.
And so one of the nice things is we actually book 30-minute appointments. So we do a secondary treatment at no additional cost to our clients while they're here, use up that full 30 minutes and really try to punch home on the depression or whatever we're treating.
So secondary treatment meaning treating the same thing 2 treatments or choosing a different area of the brain to work?
Yes.
Okay.
Both, right? So depending, like if I have somebody that has really severe depression, then I might do this treatment with what's called a theta burst, which is an even deeper, more intense penetrating treatment to really at the beginning to try to wake up that frontal lobe and cause immediate changes, right? But then I might have somebody that has really bad anxiety or ADHD, and so while they're here, we'll treat one of those as well, so that they're getting the most from their time in their treatment while they're here. That's not standard at centers to do that. It's just something that we do here to try to maximize the outcomes for our clients while they're here.
I love that. You're giving them more value.
Absolutely.
Okay, and so how does it feel? Like I see that it's a tight fit. Is this comfortable? Is it an uncomfortable position to be in for 2 minutes?
Yeah, overall it's not. What we tell our clients is you can move your head left to right. You just can't move up and down because we don't want to shift the position of the helmet. And so we have a TV on, you know, we have Netflix and all those things. We ask people to pick a funny show or something that makes them happy because we want to ignite those pathways, right? And so they get to sit here and watch the show while this is going on, and so most people have no discomfort. Every once in a while you might get a little bit of stiff in the neck just because people forget that I say they can turn left or right, and so they get a little bit sore. But overall, there are no long-term lasting side effects from this, or generally any pain associated with it.
Right, okay.
And so when we're ready to begin treatment, we just go over here and we already have it what's called pre-mapped. So in this case, we're ready to treat Miss Kayla. And so we'll begin treatment and we charge. All right, Miss Kayla, you ready? All right, and 3, 2, 1. So as you can see, it's pulsing, right? And so it pulses for about 4 seconds, 2 seconds, excuse me, and then it has an 8-second cool down where that machine is cooling down. I don't have it on right now for noise, but we have an advanced cooling system that you can hear. And that's what enables us to be able to do the treatment very quickly in just those 10 minutes.
Wow.
And I often have clients do this, and if you're feeling brave, all right, I'll show you first. I'm going to put my hand inside the helmet here, and I'm going to hit charge, and I'm going to hit start. Oh! No, I'm just joking, right? And so as you can see, I have my hand in there, so if you want to, you can put your hand in and see.
Let's see. Okay,
See, no pain, just a little pulsing there. And so that's what the standard treatment is like and feels like with Deep TMS.
Wow. And so let's talk about how many treatments are necessary. So is this something that people continuously get every couple of weeks throughout the year, or is there a specific treatment plan?
Yeah, great question. So it depends on what we're treating, but the standard treatment for depression, you actually come 5 days a week. And you're going to do that for 6 weeks.
Okay.
And then in the 7th week you come 3 times, and the 8th week you come 2 times, and in the 9th week you come 1 time. So it's kind of a taper off, kind of like you would taper off a medication, right? And typically what we see is generally by week 2 to 3 is when people begin to notice a difference. And after that we tend to see continued improvement. Now, everything that we're treating, whether anxiety, OCD, ADHD, it has different treatment protocols and lengths depending on what we're treating. Not all of them are as long as the depression treatment is. But the great thing about this is you can come here, you can get your treatment, and you can drive yourself home, right? You can go straight to work, right? You can come here on your lunch break and get a treatment. And so we try to design it to make it easy to fit into people's schedule. So they can get this treatment done.
That's awesome. So let's talk about results. So after those tapered treatments, how does a person feel after that? Or what's I know there's no recovery, but are they cured, or will they have to be reassessed?
Great question. So the FDA studies show that Deep TMS has about a 65% remission rate, success rate. At our office, we run closer to about 80%, and I think that's because of the secondary treatment that we provide. And so, it's remission. There is no cure for depression. And so when it comes to kind of like thinking about cancer, right? Right now we can cause it to go into remission, right? But there is no cure per se for, and so depression's the same way. We don't have a cure, but we can cause remission. Now, how long is remission? That can really vary on the individual. It could be a year, it could be 5 years, it could be 10 years. The great thing about Deep TMS is most insurance companies now, if you respond to Deep TMS and they see a response as a 50% improvement in your depression scores or greater, then most insurance companies after 6 months or a year will repay for treatment for you. So if you go into remission and then let's say a year and a half later something happens in life and you find that you go back into a depressive state, that's when we tell our clients, don't wait, right? Call right away so we can look at getting you approved for retreatment.
Wow, that's so awesome. It's so cool to learn about this alternative to having to take medication. I mean, that's the thing that sometimes can take people down different avenues. So this is an alternative treatment method, and it's new to Fort Wayne because you brought it here and people have an opportunity to try it out. So if someone is interested in learning more or to see if it's a right fit for them, do you offer consultations?
Yeah, we absolutely do. We do like people talking to their existing psychiatric provider to let them know their interest, right? Because we like to collaborate with the team, but then they can call and we'll set up an intake. And generally somebody like Kayla will talk to them first for 10 or 15 minutes and do some initial questions and make sure that they're potentially eligible, and then they'll set them up for an appointment with me so that we can dive in a little bit deeper, make sure they're appropriate, and then we start the process of getting it approved through their insurance company.
The insurance. Okay, so is it best for people to, like, what if someone is experiencing signs or symptoms of depression and they may not have a psychiatrist? Do you recommend they take that step first, or can they contact you?
Yeah, so TMS is generally not considered a first-line treatment, right? Insurance companies will not pay in most cases for TMS as a first treatment. The requirement generally is that you have failed 2 to 3 antidepressants. And so if somebody is having their first episode of depression in their life, then we absolutely recommend that you reach out to a psychiatric provider, primary care, whoever, and get immediate help, right? And then if they do that and they find that they've started a couple medications and they're not working, then it's appropriate to reach out to us. But if it's somebody that's already failed 2 or 3 medications, then they by all means can reach out to us directly to start that process. Okay, awesome. Thank you so much. Absolutely, such a pleasure being here. And if you would like more information about Viking Psychiatry, we'll have their website listed below, and I'll see you after the break. This segment sponsored by Viking Psychiatry.